Good morning, everyone. Thank you for joining us. Hi, I am Carol DeAndres, and I am the Stakeholder and Public Engagement Manager on the Master Plan for Aging team here at the California Department of Aging. And I'm happy to be with you today for the Equity Advisory Committee on Aging and Disability, or EACAD as we call it, EACAD. The EACAD meeting, and today is July 11th, 2024, and this is the committee's third and final general meeting for 2024. So we hope that you all are doing okay with this very intense heat. You and your friends and loved ones and pets and animals are all well. Let's go to the next slide. I'm going to go over some meeting logistics. So here we go. There's live captioning and ASL available to you. The captioning is through the Zoom functions at the bottom of your screen. Meeting slides, transcripts, and the recording will be posted on the California Health and Human Services, or Cal HHS, Master Plan for Aging webpage. So please look for that after this meeting, a week or so in the future. And committee members and guests, if you haven't already, can you please update your name display in Zoom by right-clicking the upper right corner of your video and selecting rename. Right now you have a generic EACAD member panelist, and so we'd like to know who's joined us today. So thank you so much. How about the next slide? The virtual meeting operations. The chat function is enabled for committee members and California Department of Aging staff and state staff and invited guests to share meeting-related resources and information. And the public is able to view this content in the chat during the meeting. The chat and the question and answer functions are not enabled for comments and questions from the public attendees. We do invite the public to provide comments. Please hold the comments, excuse me, please hold the comments to the end of the meeting to the designated public comment period. And of course, at any time, you may send your public comments and questions and can be directed to the Engage email box, which is engage, ENGAGE, @aging.ca.gov. Next slide. We do have Spanish language interpretation available today, and you can access that interpretation through the Zoom webinar functions. At the bottom of your screen, there is a globe that signals interpretation, and you may access that and receive simultaneous Spanish translation. So thank you very much for that. Next slide. We do want to talk to you about public comment. We will have that towards the end of the agenda. Attendees joining by phone can press *9 on the dial pad to join the line, and the moderator, myself, will announce your last 4 digits and unmute your line. Attendees joining by Zoominar, I just made a new word, webinar, may click the Zoom icon raised hand button and we'll unmute your line. Do note we have 2 minutes per public comment so that we can make sure we have time for everyone. And of course, please, if you have any additional comments or think of something after the meeting, please send them to our Engage email box. Again, engage, ENGAGE, @aging.ca.gov. Next slide. The purpose of the EACAD committee, the purpose of the Equity Advisory Committee on Aging and Disability, EACAD, EACAD, is to advise the administration on the implementation of the Master Plan for Aging. The California Department of Aging is the principal state partner of the MPA. Next slide, please. And we cannot accomplish this purpose of the committee without our committee members. So we do thank these folks for being on today and being present and being available to lend their expertise in this important endeavor. Next slide. Thank you. So I would like to turn it over to my colleague, Consuelo Gambino, to give a land acknowledgement. If you hold, there we go. Hello, Consuelo. Thank you.
Hi. Yes. Thank you, Carol. Hello, everyone. My name is Consuelo Gambino. I'm the Tribal Affairs Manager at the California Department of Aging. I am from the Yuki tribe and an enrolled member of the Round Valley Indian tribes in Northern California. So it's an honor for me to present the land acknowledgement to you all today. So today, as we attend the Equity Advisory Committee on Aging and Disability meeting, we take a moment to acknowledge the tribal lands in California on which we are gathered. For many centuries, the lands in California have been home to numerous tribes who have protected and respected the sacred lands in which we all reside. The tribes in California are sovereign nations rich in culture and traditions passed down from our tribal elders. I'm attending this meeting from Roseville, California, and I acknowledge the indigenous homelands of the Nisenan Maidu people and honor their resilience and cultural preservation. So thank you. I will go ahead and pass it back to Carol.
Thank you. Now I am going to add Marina's spotlight. Go ahead, Marina.
Good morning, everyone, and thank you for joining today. It's a pleasure to be with you, and I appreciate the time that you've taken to be with us here today. And thank you, Consuelo, for just opening our meeting in a good way. I'd like to walk through the agenda for today. I'm happy to report that we've just created some space in our agenda so that we can have some dialogue. So I'm really wanting to hear from you regarding some topical areas that are listed. Next in the queue is an update, a state update from CDA Director Susan DeMorris. Then we will, following that, hear from our Chief of Research, Ross Lallian, on the LGBTQ, some of the findings and next steps and updates for that. Many of you have been instrumental in guiding that process. And then we've set aside an hour of time to provide you with an update on the Aging and Disability Lived Experience Advisory Board concept that we introduced at the last meeting. Unfortunately, the project lead for this, who would have joined us today, is not feeling well. And so we have our very own Yia Zhang, who will be presenting on the slides to walk you through some of the goals and the project deliverables for this concept and proposal. Next, we will be hearing from Jackie, who leads our MPA effort and is leading the California for All Ages and Abilities for the 2024 MPA Day of Action. So we have also set aside time here to hear some recommendations and explore recommendations with you all to elevate in October. Then, as Carol mentioned, we will leave time for public comment. I will summarize some of the items we heard through your input and share those out, and we'll adjourn at 12 p.m. So without further ado, I will hand it over to Susan DeMorris.
Thank you so much, Marina. And Consuelo, thank you for opening us up with the land acknowledgement. And Carol, for all the logistics that you do. I'm happy to be here today. And hello, a warm, and I'm not joking, a very warm welcome to our EACAD members joining us today. No matter where you are in our state, we're just battling this unprecedented heat wave that's continuing. And our thoughts are with everyone in every community, whether it's the extreme heat that disproportionately impacts older adults and people with disabilities, or the record number of wildfires throughout the state. This is a scary time for all of us. I also want to just acknowledge where we sit at the start, 11 days into our new state fiscal year, and we are in a much, much better position than we anticipated given the size and significance of the state budget deficit. I want to applaud all of you who had a hand in advocacy this budget season and all that you did individually and collectively to protect vital programs and services for vulnerable older adults, people with disabilities, and family caregivers. So thank you. Thank you for your advocacy, and our thanks to the governor and the legislature for their great work to protect vulnerable populations. Today, I have just one update for this group. I wanted to circle back on something that you've raised in prior meetings about gaps in knowledge and access to information among the populations that we serve and support. Basic information about what services are available, what are people eligible for, how can they access services. This is, the fundamental start of how we access services and supports in our state. And I'm very proud that during the month of May and through into June, as part of Older Californians Month, our phenomenal communications team reintroduced California's Aging Resource Guide, and we'll be sure to share it with you in the chat today. But I wanted to report out some of the great outcomes from that work that happened primarily in May, but is an ongoing campaign that we have. So the Aging Resource Guide was distributed as an insert in 51 English and 25 ethnic media publications, and it reached 2 million copies that were distributed through a variety of means, whether it's newspapers, radio, television. We distributed it also through our 33 area agencies on aging, state libraries, and pharmacies to reach a wider audience. And the resource guide is available in English and Chinese, Spanish, Vietnamese, Korean, and Tagalog. There's also an online version available, and currently we are developing a resource guide tailored to tribal communities that we hope to have available by September, so that we can use that in our the great work that Consuelo is leading with our as our tribal affairs manager and through in upcoming events in the month of September. So we're very happy that this is now available. It is not time sensitive, so the information that's available in the resource guide lives on year round, and it's a basic primer for all services and supports. We did this in collaboration with Department of Healthcare Services, Social Services, Department of Rehabilitation, Department of Developmental Services, to really lift up generally the services and programs that are available statewide. We're also pleased that through our media outreach, we were able to penetrate markets that traditionally we don't reach. That would include Bakersfield, Chico, Fresno, Los Angeles, of course, Merced, Modesto, Monterey, Oxnard, Redding, Riverside, Sacramento, San Diego, San Francisco, San Jose, Stockton, Victor Valley, and Visalia. And we've been able to launch radio public service announcements in those communities and more that continue to drive traffic to our website and to our 1-800 line for people to get started. And we had 55 news pickup stories, and we're just really pleased that it has driven a lot of traffic to our website. We've seen an increase by 330%. And the goal here is that it will drive traffic to our local area agencies on aging. So we count only the increase to the Department of Aging, but underpinning this entire campaign is to connect people with local services. So we know that that's happening, and we'll be getting data and reports out from our local AAA partners about their increase. So I can tell you, we had 56,000 clicks. We generated 2,000 impressions, and this continues. Like I said, it was launched in May, and the work continues. So you'll be hearing more about this. And that's what I wanted to update you on from our last meeting. Any questions during my time with you, or shall I return back to Marina? All right, back to Marina. Thank you all for joining today.
All right. Thank you, everybody. I wanted to just see if, and I don't know that I can see fully who's on, but I wanted to introduce two new EACAD members, David Villarino and also Lynn Fritz. Are you on the line? And if not, I will just read a little bit of their bios, and I wanted to just take this opportunity and time to welcome them.
Hi, Marina. This is Carol. We do have one ECAD member panelist. I don't know who that is, but I am not seeing David or Lynn. So if David or Lynn is on and you are the ECAD member panelist, please unmute and turn on your camera. But no, I'm not seeing either of those two.
Okay. So I'll just share a little bit, and if they happen to jump on later in the call, then I'll give them a few minutes just to say hello and introduce themselves. But so David Villarino is a second generation Latino from San Diego, and he's been the president and CEO of the Farm Workers Institute for Education and Leadership Development for the past 23 years. He's overseen the service of 130,000 farm workers, recent immigrants, and other underserved minorities in poor communities through fields education and training programs at over 20 campuses around the state. So welcome, David, and I hope that you all get the opportunity to meet him in our future meetings come 2025. Also, we welcomed a new member, Lynn Fritz. Lynn Fritz is a licensed family therapist in private practice. She is a consultant and expert witness in Indian child welfare. Lynn is bicultural. Her mother is Swedish and her father is Native American. She has lineage with the Hoopa people and is enrolled tribal descendant of the Karuk tribe in Happy Camp, California. She has served as the chair for the Shasta Interfaith since 2002, an interfaith association of 20 diverse faith traditions and various supporting groups and volunteers. So I welcome them on board. So without further ado, I'm going to turn it over to Ross Lalian. Did I see a hand? Alvira?
Again, just a personal comment as a welcome to David Villarino, a friend and a colleague of long acquaintance. We first met in the Boston winter of 1973 while picketing and organizing for the farm workers. A colleague and a friend whose work with the farm workers is unwavering over these years. So welcome, good friend and colleague, David Villarino. Thank you.
Thank you, Elvira. All right, Ross.
Thank you, Marina. Good morning, everyone. Really happy and excited to be here. We can pull up the slides. So I'm going to share some initial findings from our older adult LGBTQA survey. And the reason I'm calling these initial findings is that we're still working on some more data analysis. This is a large and rich data set, so we'll have more detailed findings soon. Because the findings I'm sharing today are at a higher level, but nonetheless still helpful, still important, and we still found some common themes as well. As a quick reminder, we encourage anyone who is a member of the LGBTQIA+ community, at least 50 years of age and a California resident, to complete this survey. Our goal was a minimum of 1,000 responses, and we ended up with approximately 4,725 responses. And the purpose of the survey was to better understand the needs and experiences of the community, and hopefully these data will also help to spur effective policy. So we can start with who responded to the survey. In terms of age, I think the respondents are pretty well spread out. About a quarter of respondents were 50 to 59 years of age. About a third were 70 plus. And the largest segment was the 60 to 69 population. In terms of race, the respondents were primarily white, midlife, and older adults. White-only respondents made up about 78% of the total population. So definitely room for some improvement in terms of really trying to ensure that the diversity of our state is more represented. For example, only 9% of our respondents were Hispanic, and we definitely want that number to increase in future iterations of this survey. Most respondents were cisgender. That was about 89%, while 11% were transgender or gender expansive. In terms of sex assigned at birth, 62% of respondents were assigned male sex at birth and 38% were assigned female sex at birth. Something else that's important to point out is that we did receive responses from all regions of the state, urban, rural, frontier, north, central, and south, so that was nice to see. Next slide, please. So a positive finding is that 86% of respondents indicated their quality of life was good or excellent. We also started seeing some disparities in findings here. So for example, 18% of people of color reported a fair or poor quality of life compared to only 13% for white-only respondents. A greater percentage of transgender and gender expansive respondents rated their quality of life as fair or poor. That was at 21%, compared to cisgender respondents at 14%. And there were higher percentages of transgender women, 25%, gender expansive respondents assigned female sex at birth. That was at 24%, and transgender men at 20% who reported lower quality of life in comparison to other groups. So we generally found that across survey domains, challenges are greater for people of color and transgender and gender expansive populations. And this really underscores why it's so critical that representation in these data collection efforts is so critical, why it matters so much. Next slide, please. So this team carries over to physical and mental health. So people of color are more likely to report having a worse quality of life, overall health, and physical health than white respondents. The highest proportion observed was among Middle Eastern and North African, Black or African American, and respondents who reported more than one race and or ethnicity. Transgender and gender expansive folks are more likely to report having a worse quality of life, overall health, and physical health compared to cisgender respondents. About a quarter of all respondents reported their physical health as fair or poor. 17 respondents were living with HIV, but that number did vary by race, ethnicity. 25% of Hispanic respondents reported living with HIV, and 24% of Black or African American respondents. In terms of mental health, I think there were some really serious, eye-opening, kind of sobering findings. For example, about 1 in 10 respondents had recent serious thoughts about suicide in the past 12 months. Middle Eastern or North African respondents and American Indian or Alaska Native respondents had the highest rates of serious suicide ideation in the past 12 months. And transgender and gender expansive folks had higher rates of having serious thoughts about suicide. Nearly half of respondents had experienced a traumatic event in their life, and nearly a quarter of respondents had symptoms consistent with post-traumatic stress disorder. People of color, transgender, and gender expansive folks reported higher rates of experiencing that traumatic event within the past year. So again, really sobering findings there, and I think these findings really point to the continued emphasis on behavioral health and how critical those interventions were always going to be going forward. Next slide, please. So the next topic is going to be economic well-being, and the data suggests substantial economic disparities among LGBTQIA plus older adults, particularly across different demographic groups. So financial insecurity affected over a quarter of respondents, with higher rates among people of color and transgender and gender expansive individuals. And financial insecurity was defined as struggling to pay bills because of insufficient income during the past 12 months. So 35% of people of color reported experiencing financial insecurity, and 39% of transgender and gender expansive respondents. About half of the sample indicated that they were actually retired. About 22% of respondents were employed and working full-time, 12% working part-time. About 11% indicated they were self-employed. About 10% of respondents indicated they were disabled and unable to work. 3% are unemployed and looking for work, and 3% are unemployed and not looking for work. A lot of information, but I just want to show you how kind of wide the spread is in terms of the different experiences captured here. In terms of income, I think an important finding is that a larger proportion of people of color, 15%, reported income of $20,000 or less, compared to white-only respondents that was only at 9%. And about a fifth of respondents worried about not having meals, and this included 33% of people of color who had food security concerns, and 32% of transgender and gender expansive respondents. Also, a greater percentage of people of color work beyond the full retirement age for Social Security benefits. That's shown on the slide there. Next slide, please. LGBTQIA plus older adults in California often reported experiencing discrimination in the past year, with the most common reasons for discrimination being related to age or sexual orientation. Discrimination rates were higher among people of color, transgender, and gender expansive individuals carrying with that common theme. Almost 1 in 5 respondents report abuse, with verbal abuse being the most reported. The majority of respondents did not report these incidents of abuse due to shame and distrust of authorities related to being an LGBTQIA plus person. And concerns for safety for the community that was a common response. People of color and transgender and gender expansive folks reported more concerns about safety. approximately 1 in 4 respondents, right about 27%, reported being treated unfairly with less respect than others or discriminated against in the past 12 months. Approximately 41% of people of color and 24% of white respondents reported experiencing discrimination in the past 12 months. And as transgender, gender expansive respondents reported higher proportions of experiencing discrimination as compared to cisgender respondents. That was at 49 and 25% respectively. Respondents felt that they were discriminated against for the following reasons. So I mentioned age and sexual orientation are the top two, but followed by body size and weight. About a quarter of respondents said that they were discriminated against for their body size or weight, followed by gender identity, ability, disability status, and about a fifth of respondents said that they were discriminated because of race, ethnicity, and or skin color. So the prevalence of these experiences, abuse, and concerns about safety, I think really underscores the need for targeted programs, interventions to enhance safety. And that's not breaking news necessarily, but I think to have hard data now to show how widespread this issue is, that's powerful. Another important finding is about a fifth of respondents reported being in abusive or threatening situations over the last 12 months. I don't have anything to actually compare that to, but it seems like a very high percentage. So some eye-opening findings there as well. Next slide, please. Recommendations. So in terms of recommendations, we're still fleshing them out. However, we do have a few initial recommendations. Also want to let you guys know that we still have a lot more findings soon. Again, it's a very rich and large data set. So I look forward to presenting more findings and recommendations in the near future. So it's kind of scratching the surface now. The first recommendation here is to improve access, inclusivity, and safety of services for LGBTQIA older adults to promote healthy aging. How do we do that? There's a couple thoughts here is to increase the number of LGBTQIA affirming healthcare providers, first responders, caregivers, and caseworkers by providing training for competency and working with the community. Also, beyond training, I think it's important to get more of the community in the health workforce pipeline, more of the LGBTQIA plus community. Cultural concordance is critical, so we need to diversify that health workforce pipeline. We talked about mental health related findings around suicide and trauma. Those really stuck with me. So increase access to suicide prevention services for the community, and then increase access to trauma-focused treatment and support for LGBTQIA plus older adults. Second recommendation is to increase social and economic support for LGBTQIA plus older adults, support and expand LGBTQIA affirming programs and strengthen social networks, reduce isolation, expand resources and services that promote economic security, and provide mental health treatment and social support for LGBTQIA plus older adults for experiences of stigma and discrimination. The next recommendation is to address disparities among transgender and gender expansive older adults and older adults of color. I mentioned that several times already. There are sweeping disparities in survey findings. That was a huge finding for us. So incorporate training to improve services for older adults, for people of color, and or transgender and gender expansive people, incorporating the services, programs, and licensing of those who serve older adults, develop and also implement guidance and standards of care for serving older adults or people of color, transgender, and gender expansive. And then the final measure here is to measure policy outcomes and improve data collection among LGBTQIA plus older adult communities. So collecting sexual orientation, gender identity data across state level data collection forms to help identify the needs of the community. That's a really important recommendation. I think we need to move towards administrative data instead of survey data. Survey data is important, but administrative data is where we really get to where we need to be at. Track health and well-being outcomes of policy and programs for LGBTQIA plus older adults. Program evaluation is critical. And we say this a lot, but I think it's so important. We need to keep saying this. We need to build relationships with communities of color, transgender, gender expansive communities, and other vulnerable communities for more representative data to ensure that all voices are heard, right? And we struggle with this throughout the state. That's a really important point there. Next slide, please. Lessons learned. There's some overlap between the last slide and this one. So I'm going to touch on these briefly. We think that effective community engagement is crucial for the success of these types of surveys. Open House was instrumental in this process in a coalition of 62 LGBT plus serving organizations. They were instrumental in reaching that broader group, right, and getting those over 4,000 responses. So future projects should partner with local LGBTQ plus organizations and leaders to facilitate outreach. Building these relationships early can enhance participation. The next lesson learned is collecting detailed and representative data requires careful planning. Despite our efforts to reach that broad, diverse audience, we really emphasize that early on. The survey sample is still overrepresented white, right? They're still overrepresented with white respondents compared to the state's demographics, and this highlights the challenges in achieving that truly representative sample for the state of California. Recommendations: we could use different sampling weighting techniques to ensure that representation across different groups is there. Consider using both online and offline methods to reach those without internet access. Our survey was 100% online. It was a Qualtrics-based survey. And I think the state, we should really emphasize what's in it for the actual communities who provide us with this information. What's the tangible benefits, right? Really showing folks why they should provide us with this information, this personal information. Next lesson learned is that designing an inclusive survey that reflects the diversity of the community is essential. Surveys should be designed with input from a diverse advisory committee to ensure that all community voices are represented and translations are culturally appropriate, including multiple language options, and recognizing various gender identities and sexual orientations can hopefully lead to improved response rates. And then the final point I've mentioned several times, that disparities exist within the LGBTQIA plus older adult community, especially among people of color and transgender and gender expensive individuals. So future surveys should include targeted questions to understand the specific needs of these subgroups. Additionally, programs and policies developed from survey findings should focus on addressing these disparities. Next slide, please. So one final slide, conclusion, next steps. So communities can reach their full potential unless disparities and discrimination are addressed across services. The difference in experience within the community, that was an eye-opening finding. I keep mentioning that, but that really was. And I would like us to move towards leveraging more administrative data sets to inform policy for the LGBTQA community. I mean, these surveys are great, and we need more data and fill data gaps. But with administrative data, there's less concerns about sample size, representation, weighting. It's generally higher quality data. And that's where I hope we end up at in the future. So data collection should continue, also be more robust. And then finally, the study team is working on finalizing outputs, final report, executive summary, other materials as well. There's a lot more data analysis to be done. So I'm happy to come back and share more findings. We'll be sure to share outputs with you as soon as they're ready. So with that, I know it's a lot of information. I'm happy to answer any questions if we have time, Marina.
Sure. Are there any questions from the group? Danny, I see your hand, and then Denny next in the queue.
Hi, Ross. Thank you so much for all that information and the update.
Mhm.
My question is around, my understanding is that the data from the survey is intended to become public in some way. And I was just wondering if you have any insights as to what format the data will be, where it will be housed, when might it be available for, just anybody to kind of poke around.
Right. Great question. So I don't have those details yet, Danny. Unfortunately, we're still working on data use agreements, things of that nature. And we have to be really thoughtful about how we're gonna publicly display these data, right? Protecting privacy and things of that nature. So unfortunately, not yet. I'm happy to share updates as soon as they're ready. Hopefully, we'll know that by September-ish, possibly, where it's going to be housed. It's going to be aggregated data, obviously, but how aggregated. We want to have stakeholders be able to access data at their county level, some data, right, regional level, possibly. So still one of our plans. Thank you for the question. I'll follow up as soon as I have some more information.
Cool, thank you.
You're welcome.
Thank you, Danny. Denny?
Ross, thank you for this
Hey, Denny.
presentation. I want to give you all a big shout out for how intentional you all were in trying to unpack the tremendous diversity within the LGBTQ older adult community. So thank you for doing that. I have two questions. The first is, how should we understand this data compared to older Californians generally? So, for non-LGBTQ identified older adults in our state, are they experiencing similar rates of economic insecurity? Like, how are you all thinking about
Right.
that? And then the second question is, to what extent did survey respondents, were they older adults, LGBTQ older adults who live in nursing facilities? Was that part of the experience that the data set that you all were looking at? Thank you.
Good questions, Danny. So the first one, that context is critical. The study teams are talking about that a lot. What data should we pull in to set that context, right? Like, what do these percentages mean? I threw out a bunch of percentages. It's hard to know how powerful they are without context. So I think with our outputs, we're going to blend into some external data sets to find out like this that said more context, I guess, for these percentages. I can't say with certainty based on the research I've seen in the survey findings so far, again, looking at a higher level. People of color, transgender, gender expansive folks, just across the board, a lot more challenges. But great question. I think with our outputs, Danny, we are going to fold in some external data sets to set that context. Second question, nursing, I don't have that number off the top of my head right now. I could follow up, but that was part of our population, nursing facilities, institutions as well. So I could follow up on that. We'll look into that. Thank you.
Okay, Vince, I see you in the queue. Thank you, Danny.
Hi, thanks. I missed a couple slides because I got called away. But did you talk about whether we got rural populations? Like, did we get like a fair sampling of LGBTQI plus folks from the rural, or was it all urban?
I
Ross,
went on mute on
you-
accident.
There you
Yeah,
go.
I don't know how that happened. Sorry about that. Thank you, Vincent, for all your help. Vince was part of the survey advisory group. So I want to give you a shout out as well as Jax. I don't know if Jax is on the call, but thank you all for your help. But yes, Vincent. So we actually received responses from everyone, all corners of the state, rural, urban, frontier, more urban, but we do have a pretty decent amount, I would say, of rural communities, frontier communities, in all regions, north, central, and south. So I was happy with that.
Okay. Did you see any kind of contrast or any differences with those
Great
populations?
question. That's the next steps, I think. This is a very high
Okay.
level look at the data with this. Yeah, it's a really rich and robust data set, large data set, Vincent.
Oh, good.
So yeah, that'll be next iterations. Good question though.
Thanks.
Thank you, Vince. Jax?
Thanks, Ross. That was a great presentation. Thank you for all your hard work on this. I think I just wanted to make a comment that it's really important that we get the data as low level as we can when it does get to be released. I noticed you said regional. Hopefully that will be county as low as you can get it. Because that data is going to be useful for I think the AAAs going forward, especially as it relates to the people who are aging with HIV and the HIV and Aging Act, which is supposed to really address people who are aging with HIV as a group of greatest social need. So I just hope that gets to that level. Maybe you could speak a little bit about the difference between administrative and surveys and the survey that was done here, because that's something I'm not entirely familiar with.
Yeah, that's a good question, Jax. Typically I think administrative data, excuse me, those are collected in the administration of actual programs, right? So it's generally it's generally going to be state level data with programs. So everyone involved in X program has to submit these data. So this entire sample, the entire population generally is going to be consistently collected. The variables being consistent. It's not voluntary data, right? So it's going to represent the sample of the total population generally. It's going to be government data, high quality data. Survey data is voluntary. We struggle with the state to get that representation of the state. It's such a diverse state, and we all struggle with that. So like with the survey, is an awesome survey, very rich data set, but it didn't truly reflect the demographics of our state, and that's a challenge for us. Administrative data, there's less concern with that because it's the entire population. It's going to be housed within a secure database. It's going to be locked down government data, high quality data. So it's generally a much better data set. Surveys are still important. I don't want to knock surveys. We need to do surveys. There's a lot of data gaps, right? And so administrative data is tough to collect. Survey data helps to fill in some of those gaps. Administrative data is the bigger picture, I guess. This higher quality data.
I'm sorry to interrupt.
No, go ahead.
I just wondered whether or not we as a state are prepared to collect administrative data on our LGBTQ older population, though.
Yeah, I think the state's getting there. There's some bills, Assembly Bill 1163, for example, where folks are discussing like more SOGI data, robust SOGI data. And administrative data is the way the state has to get to, right? And I think we're going to get there eventually. And those conversations are starting now. I think it's been starting for a while now. The state's had a much better place, I think, to start collecting those data. It's all voluntary data collection right now. And it's hard to require SOGI data to be collected because it's so sensitive, right? But I think the state's in a much better place now compared to even like 5 years ago, for example, to collect those data. So yeah, I think the momentum's there for sure.
Thank you.
Thank you, Jax and Vince, for your participation. And I think I see one other hand, Ephraim.
Thank you so much, Ross. I'm always looking forward to this section of these meetings to learn more. I think obviously and this isn't unique to this survey, whenever I look at the racial gaps in the survey respondents, I happen to just run into Jupiter Peraza, who's the manager of the statewide coalition. Obviously incredible. I'm sure you've been working very closely with her. And she had a lot of interesting nuance and context to some of the unique barriers that presented themselves. I'm just wondering if it would be of benefit to this committee to maybe have her come, or maybe you glean some of that, just that more qualitative kind of contextual data, so that we can learn, and even across all of the experts that are here, and all the organizations that are here, as we are all going in and trying to gather this data, what is it that we're missing? This is it's just a systemic issue across this cultural, linguistic barriers, whatever it may be. We're just not getting the that we need at the table all the time getting there. This data is still much more rich than a lot of the other surveys. And so anyway, I'm just wondering if that would be of benefit to this.
That's a great idea, I think. I think we should do it next meeting, to be honest. Jupiter or somebody from above, maybe Kathleen Sullivan can come and share those experiences. Those lessons learned are critical, right? We need to, like, the survey respondents need to be massive, the demographics of our state. And like you mentioned, it's a big challenge across all state surveys. So that's a great idea. I don't know when the next meeting is, but yes, absolutely, that should be on the meeting agenda. I'm happy to present, but it could be Kathleen or Jupiter.
Right. Thank you.
Thank you.
Thank you, Ephraim. And I noted that Jupiter Barraza and also Kathleen Sullivan. So I'll work with you, Ross, for our next meeting. And thank you for all the robust dialogue on this topic. And
absolutely,
always appreciate you, Ross, and all your effort.
Yeah.
I see two more hands. So Vince and then Marielle.
I wanted to know if we might be able to get some of the info for to use as talking points for when we do the day of action in October. Would that be possible? Because we're having this day of action that we're going to, would it be possible to pull some of these things so we can use that and actually talk? I know that when I've done other days of actions, it's helpful if we can kind of tease some of the things out by like counties and stuff like that, or their specific needs, so that when we go to the Capitol, we can specifically address that, if that's possible in such a short amount of time.
You want to take that one, Marina? I think we could talk to Susan about that, Marina, and get back to Susan and Sarah and get back to you.
Yeah, that's what I was going to say.
Though.
We can definitely elevate that question and circle back. All right, Marielle.
No, I didn't have a comment. I just hit the wrong button. My apologies.
Okay. All right. Well, we'll wrap this up. And I want to say that I did see Lynn on now. So Lynn, I did a brief introduction of you, but I wanted to welcome you on board. And I wanted to give you just a few minutes to introduce yourself before we move on to the next topic. Oh, there you are. Hello and welcome.
There. Good morning. I was on by phone.
Oh, okay.
Yes, and I'll switch back to phone as soon as I do this portion, but I'm privileged to be in this association and working to outreach into the communities, especially rural communities that oftentimes are isolated. And so working, not only my particular interest in being Native American is reaching populations of Indigenous people, but that I also work with spiritual diversity, I work with cultural diversity. And so it's a great opportunity, I think, we have to collaborate and work together to work on the topic of aging. So any questions?
Do we have any questions from the group? No, I just feel like a resounding welcome.
Oh, that's awesome. Thank you much.
Thank you.
Yeah, thank you.
Thank you for being here.
Yes.
All right. So moving right along, I know we're a bit behind schedule, but you know what? When we have robust conversation, we want to keep it going, right? The momentum going. So thank you all. The next topic I want to move into is the EACAD and the Aging and Disability Lived Experience. And so if you all recall, this kind of idea and concept was presented at our last meeting on April 11th. And this really came by way of my boss, Sarah Steenhausen, who thought that we can better capture the voices of many communities that we're still not engaging with. And so really identifying some of the gap areas. And so we started to explore this idea of an Aging and Disability Lived Experience Advisory Board that would help work closely with EACAD, but then would help embed and infuse equity throughout the MPA committees, the 6 MPA committees. And so this, at the time when I presented, I presented on the purpose and the value proposition, which really is about grounding and centering our work, always keeping our eye and our pulse on, the needs and the barriers and what the community is saying that they need to access services, to be able to inform their caregivers or others about just what services are available. So pretty just kind of boots on the ground information. And so we wanted to see how that could really happen. And we felt there was a sense of consensus among you all about moving this forward. So we started moving on it. And, this partnership of EACAD and the Aging and Disability Lived Experience Advisory Board would really help to lift many of the kind of concerns and issues that have been raised within this committee as well. But it's also an opportunity to thread, if you will, and weave all the committees so that the Aging and Disability Lived Experience Advisory Board members wouldn't solely work with EACAD, but would work with the other committees as well in terms of providing subject matter expertise, being available to support and consult if there's new program development or recommendations for policy or structural changes. And so I'm very happy to be at this point, and all in an effort to embed equity lens framework within the MPA and through, like I mentioned, the advisory committees. So next slide, please. I also shared this illustration, if you will, that really speaks to the bi-directional partnership in this. So how we would work with AdLib and the AdLead would work with us. So again, the point committee would be the Equity Advisory Committee on Aging and Disability. However, we would infuse that expertise to our other committees, either on an as-needed basis or on an ongoing basis. That's yet to be determined. And because, when we're talking about outputs and outcomes and measurements, we really want to be able to highlight that we've minimized our gaps, that we've really moved the needle within the MPA and, within the initiatives that are focused on older adults, people with disabilities, and caregivers. Next slide, please. So from our last meeting, we went to work, and given that there's many fiscal restraints, we wanted to not only research what advisory board, concepts are out there that we could cut, paste, and borrow from, but then also tailor and improvise as needed for the stakeholders that we serve. So we met with other organizations and departments for guidance, so for example, the California Department of Public Health. I believe we also met with the Department of Social Services and others to just, learn about what was working well for their groups and, lessons learned type of information. From that standpoint, we selected Mandela Change Group under the leadership of Maya Thornell Sandofor, who will serve as the principal consultant. And we worked to develop a proposal to submit to our MPA philanthropic partners for their review and consideration. We are in the process of finalizing, responding to questions, developing a budget narrative, looking at deliverables. And so next in the queue is my staff, Ye Zong, who will be the lead person on the further development of the Aging and Disability advisory board. And so unfortunately, as I mentioned, Maya could not be with us here today. But Yia will be going through some of her slides, and I'm hoping to leave time for discussion, so that you can provide feedback. And also at the very end, for those of you, I know there were a few of you from last time who were interested in working in a committee or a smaller group to help further develop what this will look like once this proposal is finalized. And so we definitely want your, input as we move along. So Maya, as I mentioned, will be the project lead and facilitator for this project. She's worked with MetaFund. For those of you who aren't familiar with MetaFund, MetaFund advances the health and well-being of older San Franciscans. And so it's a health-based foundation. And she's worked with MetaFund for the last 2 years, bringing racial equity into their program and grant-making strategy. She structured and facilitated opportunities for older people and people with disabilities, specifically in San Francisco, to share their lived experience to inform Meta's capacity building support. And so with that, I'm going to hand it over to Yia to walk us through some of the goals, the deliverables, the tactics, and then leave it open for discussion. Thank you.
All right, thank you, Marina. I'll do my best on presenting these slides. And so again, our principal and CEO of the Aging and Disability Lived Experience Advisory Board, or ADLIB, is Maya. She lives in Oakland and is a caregiver to 3 older adult parents, one with disability. She has 25 years of experience in supporting organizations and leaders in their efforts to align their organization's practices, policies, and cultures to values-based missions and visions. Maya is also a certified diversity professional and coach with a master's in organizational development. Next, we have the project assistant and administrator, Ronnie. She provides administrative support to this project, including scheduling and operations. And so next slide, as part of the proposal, the ADLIB creates an opportunity to learn directly from the most impacted older adults, people with disabilities, and caregivers about their ability to access services that allow them to age and live with dignity. Older adults who are aging at the intersection of multiple identities, such as race, ethnicity, disability, mental health, gender identity, sexual orientation, language access, low economic status, and rural or isolated communities are particularly vulnerable because they experience compounded inequities that lead to disparities. The ADLIB will center the experiences and expertise of the most underserved and underrepresented older adults, adults with disabilities, and caregivers to better inform the NPA solutions to address the gaps in systems, programs, and services that further exacerbate inequities for this population. So next slide. So there are 2 parts to the ADLIB framework. Part 1 focuses on the goals, deliverables, and tactics. Some of the goals are to embed community input through an equity-informed approach with representatives of the older adults, people with disabilities, and caregivers from underserved and underrepresented communities. Another one is to deepen the understanding of what programs, services, and support systems older adults, people with disabilities, and caregivers identify as contributing to living with dignity and care. Some of the deliverables associated with the goals are outreaching and recruiting for the ADLIB, design and the facilitation of the ADLIB, provide a feedback loop and inform exchange between the ADLIB, the EACAD, and other NPA stakeholder committees. Some of the tactics that we're employing are to provide learning and reflection on future design and implementation, provide caregiver and aid support, and engage older adult serving programs and agencies to support and provide their nominees for the ADLIB. Next slide.
Another goal is to identify the barriers named by the older adults, people with disabilities, and caregivers and systems, programs, and services that further exacerbate inequities they experience. And an additional deliverable is to capture and document the learning of the AdLib and write a final report. And then we also want to be transparent on the information shared with participants, stakeholder committees, and the agencies that we'll be working with. Next slide. Part 2 of the framework focuses on like the problem statements and the focus of the change, as well as strategies and outcomes. The problem statement is that existing, what Marina mentioned, that the existing MPA stakeholder committees, while we are diverse, we do not currently engage older adults, people with disabilities, and caregivers with intersectional identities that reflect the populations in California experiencing the most challenges to accessing long-term services and support. We want to shift in providing voices from older adults, in providing voices from the older adults, people with disabilities, and caregivers in California who disproportionately experience inequities to navigation, access, financial, and workforce. Some of the strategies that we want to employ are convening, creating an accessible, safe space to provide and share their experiences on solutions in the MPA, being person-centered. Next slide, as well as lived experience. As well as listening, reflecting, and advising. Some of the outcomes that we want to achieve are to gather qualified data from lived experience on what's working and where there are gaps for the older adults, people with disabilities, and caregivers in California. Another outcome is that we want to have the AdLib informed practices to address gaps and opportunities in the NPA that facilitates equity for disproportionately impacted older adults and people with disabilities. And last but not least, the NPA solutions and experiences will reflect the real experiences and the needs of older adults, people with disabilities, and caregivers who experience the intersection of compounded inequities that lead to disparities. Next, we have a projected timeline of the AdLib within the next couple of months. We want to finalize the AdLib criteria and charter for recruitment and onboarding. We want to announce the concept at the Day of Action in October, and then we would have our first AdLib meeting in February of next year. Additionally, we will have plenty of learning and sharing feedback with the EACAD throughout the project, and then before providing a written report on lessons learned and recommendations in February of 2026. So next slide, sorry. Again, as I mentioned, plenty of learning and sharing with the EACAD. And then next page, we also want to share our preliminary thoughts on the priority recruitment criteria, individuals who are 60 years of age or older, persons of color, adults with disabilities, unpaid family and or friend caregivers, the LGBTQIA+ communities, residents of rural parts of California, and persons with very low income. Our process for recruitment, next page, sorry. Our process for recruitment includes nominations from the NPA stakeholder committees, nominations from older adult serving agencies and programs in priority counties. The Mandela Change Group will interview the nominees that meet the criteria. The EACAD members and CDA will play a role in the selection process. And then, the Mandela Change Group will bring proposal members to the EACAD and then to the EACAD and CDA for approval. Again, we are in the early stages of developing this proposal, and I know that I did not do this presentation justice, but thank you for listening. And then we'll open up for discussions, questions, or concerns from the committee members.
Thank you, yeah. Thank you for just stepping in and at least, informing the members of kind of that high level of framing that we're thinking of. I see a couple hands, or at least one hand. So I'm going to turn to Jax and then we'll open up for discussion more broadly. Jax?
Hi, thanks. Very good presentation. A request quickly, two questions though, but a request to go to framework part 2, the slide.
I think Kelly. Is this what you're, okay, right here. Framework part 2.
Yeah, so I was a little concerned, especially if this is going to get presented in October and for the day of action, where it says here, existing MPA stakeholder committees, while diverse, do not currently engage older adults. There might be some people who bristle at that, and that could actually decrease the support for this initiative if you actually tell people that they're not engaging with their obviously older populations. I think in some ways we all do. So that might be a little an issue. And then the one suggestion that I do have is that because I serve on a AAA community advisory group, I didn't see whether or not anybody was going to go to those AAA community advisory groups to look for these potential members. They might, and especially if you know that you're targeting certain communities. I don't know if you're actually going to those AAAs and those communities and saying, are there people on your community advisory board that would actually be interested in working on this?
Thank you, Jax, for pointing that out in terms of the verbiage. I don't anticipate that this will be shared at the day of action, but still, I appreciate the input and I can see how that can be taken. So we'll make some revisions to that in working with Mandela Group. And then thank you for the suggestion regarding the AAAs and the community advisory groups there. So we are open to where our reach will extend to for recruitment purposes. So, okay, Denny?
Yeah, thank you. And I'm really happy that CDA is undergoing this effort. So I have a couple of questions. The first is I'm wondering if Maya will be at the day of action. I think it'd be really great, recognizing that this is, I think, our last meeting of the year, and that we'll be together in person in Sacramento. I'm wondering if she can be there. It would be great, I think, to meet her as this process is unfolding. So that's a short question. And then my other two questions are a little bit more substantive. The first is, so one of my concerns around this project, as much as I think it's well needed, is that I'm worried that the work of the group will live in a vacuum and it won't actually be integrated into the work of the MPA. I think that concern is not without precedent. I mean, I think one of the challenges even with this committee is that we are kind of in our own little silo, and it's been tough to integrate this committee with the work of the MPA. So if we pull the layers of the onion back, I think of the work of the MPA as the many, many initiatives that CDA has identified in partnership with other government entities to advance change for older Californians. So I'm wondering if someone here can speak to how we see the connection between this group of older adults with lived experience to the specific initiatives that are identified in the MPA. I'm still a little bit hazy on what that connection and integration will look like. And I'm concerned that we'll put all this effort into pulling a group together that will learn interesting things, but it won't actually be integrated into the work of the initiatives. So that's question number one. Question number two is, I think one of the other challenges in this project is the recruitment of older adults to this group, because we are so interested in various types of diversity. There are not going to be enough seats, so to speak, to assemble a full panel that is truly representative of the older adult community here in this state. So keeping that in mind, I think it's important to include perspectives of older adults who are actually not connected to services. People who aren't getting meals through their AAA, who aren't getting case management, people who barely know they're on Medicare and Medicaid, quite frankly. And I think if we're really interested in identifying what barriers people have to getting services, it's like what you all were talking about. People don't know what's out there. And so I think that perspective is really important. And I would encourage you all, I guess this last is not really a question, but I would encourage CDA to think of ways to get people who are not already connected to services as part of this group. And I was just toying around with an idea like, could you partner with DHCS to do some sort of mailer to people who are dually eligible for Medicare and Medicaid? That's one half-baked idea, but like I just think it's the more that you reach out to people who are already on CBAS, already doing all the things, they're in a place where we want, those perspectives are equally important, but I am particularly interested in people who are not connected to services being part of this advisory group. So that last point was not a question, more so a point. Thanks.
Thank you, Danny. So related to Maya, yes, we have invited Maya and are hoping that the proposal will be approved so that she can attend. But I think there's commitment from her either way, because that's her time and we'd like to pay her, but you know how that goes if things aren't in motion. But she is committed to being there. So I'm happy to report that out. She's been invited and it's on her calendar. Thank you for raising the issue regarding, that this group will live, pretty much lives in a vacuum, and how do we integrate? So I'm glad Jackie is on the meeting today, because I'd like to hear her perspective. One of the ideas I have is just having a meeting with the MPA committee leads to have more discussion, and maybe that can be, an initial meeting, internally at CDA, and then inviting some EACAD members to, a second meeting where we can share some thoughts and ideas on how to do that, and just begin the dialogue so that we can, again, like I said, weave and start threading some of these efforts. So thank you for raising that. And then it's very interesting that you bring up including the perspective of older adults that aren't kind of like in the system or already receiving services, because recently, especially with Consuelo being on board and us just having some initial meet and greets with tribal communities, they don't even know about CDA. They don't even know what we do. So I really appreciate that angle, and I would really like to make a concerted effort to strategize on how to do that. And we do have some connections like at DHCS and things like that. So whatever those ideas are, please just email me and I'm happy to pursue them. And so I want to turn it over to Jackie to see if you have any kind of thoughts or ideas, Jackie, on that.
Thanks, Danny, and thanks the entire committee to sharing your thoughts and perspectives about how we can ensure that this advisory board is an integral piece moving forward as we implement California's master plan for aging. So while we need to develop some type of charter or framework for this group, we want to do that in collaboration with EACAD as that initial. So having these conversations, you all bringing up these issues, these concerns, these pressing points that we need to address will help us develop that framework of how this advisory board can interact with not only EACAD, but how it can interact and engage with the other MPA committees. So I think that there is an opportunity here with the membership we have on EACAD. And again, it could be the larger committee, or maybe it's just a smaller subset, just based on kind of everyone's schedules and such, of how we can develop that initial framework that helps guide the advisory board moving forward. But then we also recognize that things are only successful if people are included in the process. So thinking about that framework, while we might have something initially so people know what they're signing up for and, volunteering to do as respective as a member, we want to ensure that the advisory board members have an opportunity to provide additional feedback on that framework, on the charter that's guiding this work, because it's only going to work if it has that contributions from the people that are impacted from the work. So I think there's a few points here. I think we are committed to partnering with EACAD to help develop a lot of these initial materials. And then once members are on board, allowing them the opportunity to provide input and feedback as well. So it's more of an iterative process. So appreciate your point there, Denny. Let's have you a part of that subcommittee and others.
Denny, I also wanted to mention that when Maya is better, and even though this is our last meeting, I'm happy to pull together a meeting with her and whoever is interested on this committee to meet her and to, just either, ask further questions or brainstorm. So I'm happy to do that follow-up with Maya. Jax, I see your hand up. I'm not sure if that was from previous, so I want to give you an opportunity.
Nope, sorry.
Okay, no problem. Are there any other questions?
And I will also just add, sorry, Marina, just back to Denny's point, working with EACAD too, and our other MPA stakeholder committees, we do need to talk about outreach, recruitment strategies. What does that look like? Because you bring up a very...
¿Cómo se mira eso? Porque todos tenemos algo que
My
comentar.
apologies, I think our Spanish translation coming through. So essentially, I think we do need the input from committee members such as yourself, as well as our other MPA committee members to weigh in on the composition of the memberships that's going to comprise the advisory board. Because again, I think you just bring up a valid point with regards to, okay, not always gathering people who are already connected to the services, but what about those who don't know about CDA, don't know about the AAA network, don't know about services that our state partners provide as well. So I think that's all part of how we want to work with EACAD as part of this process moving forward.
Yeah, absolutely. So my question to the committee is more about just operationalizing this further. So there's a lot that we can do, just sending out emails and, can you review this, but to me, I think what's more important is the dialogue that goes with it. But I'm open and eager to hear what's the best way to garner your feedback as we move forward, like what Jackie described with the recruitment and with the, reach and, just making sure that we stay on point, and address some of the concerns that were brought forward today. So I'm going to pause there, and I would just like to hear from the committee. Yes, we do plan to have a smaller group, working side by side with Maya. I think there were three, like I mentioned, 3 identified, but for the larger group, just so you're keeping apprised as to our progress, and, if there's areas that we are missing the mark on, what is the best way for you all for us to do that? All right. Well, I'm gonna let you give that some thought. You know how to reach me. And then if not, we'll just do our best and, just proceeding how we feel we can get the most feedback as we develop this. So, all right. All right. Well, this is all good leading up to the day of action. So I want to turn it over to Jackie to just give us an update on, kind of the expectation and the focus of the day of action and just reminders and making sure you all are registered and just giving space as well so you all can ask questions. And then I'm going to take it over from there I want to remind a few folks about the survey that was issued to the EACAD members in February of 2024 and highlight some of the priority areas that were identified. Although we didn't get a big response rate, I think there were 5 or 6 of the members who replied. It's something to work with. And so, and then we can have some further dialogue about what what priorities we want to elevate in October. So Jackie, take it away.
Hi, everybody. For those of you who don't know me, my name is Jackie Tompkins. I serve as California's Master Plan for Aging Project Director here at the California Department of Aging. And yes, here to share some exciting news with regards to our California for All Ages and Abilities Day of Action happening this fall. I was able to speak to many of you back in April when you had your last committee meeting. And we've also sent out a couple of communications letting you know that this event is A, save the date on your calendar, and B, the registration is now open and available. And we definitely want to encourage that all MPA stakeholder committee members, including all of the EACAD members on this call, are registered for the day of. We're looking to host this event on Tuesday, October 8th, here in Sacramento at the Safe Credit Union Convention Center. And while the time is still kind of to be determined as we build out the agenda, I will just say at this time to please just kind of mark off the full day for this event. Likely a start time, joining us for registration and networking around 8:30 with the actual program starting at 9, and hoping to also be able to end around 4:30 with a networking reception as well. We do want to thank our MPA philanthropic partners for supporting this event, and they're all listed here. Without their support, this event would not be possible. So a big thank you to them. Going to the next slide, I just want to share some highlights with the committee as well as others who might be joining this call about what to expect at the Day of Action. So the Day of Action is really an opportunity for us to hear directly from the MPA stakeholder committees as well as other attendees on the highest priority issues that are facing older adults, people with disabilities, and caregivers in California. California's Master Plan for Aging initiatives are refreshed every 2 years. So we're really looking to this event to inform the next iteration of the Master Plan for Aging initiatives as we go into the year 2025 to the year 2026. And this helps us to ensure that we are responsive to changing information, changing needs, but also can progress on past initiatives and reflect upon those initiatives and refresh them, revamp them, or maybe even transfer them over as needed. We're really looking to also center this day on equity and lived experience, and I'll be able to talk a little bit more about that as we go to the next slide, but don't go yet. Sorry, Callie. That was a bad prompt on my point. On this day, we also want to be able to highlight the progress to date that California collectively, with your support, governmental support, community-based organizations, have done to advance the Master Plan for Aging 5 bold goals. We are essentially at that 5-year mark of our 10-year blueprint. So it's a great opportunity to reflect on the success and progress to date, but also to challenge ourselves, renew our commitment to the state's Master Plan for Aging, and revise, refresh the initiatives as we see fit as a state and with our partners. This is also an opportunity where we can bring together not only a whole of government approach by bringing in a variety of state and national leaders to demonstrate how cross-sector collaboration is needed when we talk about issues impacting older adults, people with disabilities, and family caregivers. But really, I like to think about this as a whole of society, whole of community approach. We are inviting the MPA stakeholder committees. We're inviting public members, stakeholders who might not be members of committees to attend this event as well. And it's really designed to serve as a model for not only within our state, but nationally as well. So we are still in the planning stages, and you can go on to the next slide, Callie, but I just wanted to kind of give you a sense of the day and what to expect. And additional information will be made available over the course of the next month or so leading up to the day of action. But this is just to show you some of the items on the agenda. I told you that we wanted to ground this day in lived experience, hearing from communities, priority populations, and center it around equity. So we have a panel of consumers, those who are older adults, people with disabilities, and caregivers who will talk about their experiences with current systems, current programs, and also their challenges with such systems and programs. And this really is designed to start the day with grounding us in the why we do this work. And for me, I always find that valuable in going back to why, and that keeps me motivated every day moving forward, is to understand that the things that we are accomplishing through the Master Plan for Aging are really designed to positively impact the day-to-day lives of our communities, as well as the broader community systems change. So we do have a panel that will start the day off from that consumer perspective. Additionally, this is also a time where we want to hear from all of our 6 MPA stakeholder committee members. So there will be an opportunity for EACAD, as well as the other stakeholders committees, to share out their priorities, their recommendations. And I appreciate the earlier comments this committee had about leaning into the survey that Ross presented on, talking about priority populations, talking about lived experience. So there is time on the agenda for each stakeholder committee to present those priority recommendations moving forward. And for EACAD, that might be, talking about the upcoming Age and Disability Lived Experience Advisory Board that Yia and Marina just presented on. You might also have further recommendations on person-centered approaches and working with priority populations, or even thinking through the workforce lens, culturally competent, culturally humility programs, services, materials. So just giving you some ideas there on what you all might want to put forth based on some of the conversations that I've been a part of as it relates to EACAD. And then we're also going to be sprinkling in some engagement opportunities with our state leaders from the multitude of agencies and departments that comprise California's Master Plan for Aging. So we'll hear some insights from those state leaders, again, highlighting what progress has California made to date on the Master Plan for Aging. Critically important that we be able to reflect and talk about that progress and measure that progress, but then also knowing the stakeholder committee recommendations, knowing new information from maybe those in attendance, talking about additional priorities and recommendations, and maybe planned programs, planned integrations, planned collaborations. So you're going to hear diverse perspectives and conversations from those in housing, transportation, social services. I'm sure I'm missing some, but we're really looking to have robust, engaging panels with our state leaders, and also opening up space during the day of action where audience members, again, those who may not be involved in a formal stakeholder committee member, can have that interaction and provide additional input to the state on California's Master Plan for Aging. And then we're looking to close out the day with having a conversation with legislative policy and budget staff on opportunities there to continue to advance systems change through the Master Plan for Aging, despite challenging fiscal times and climates, and what are some opportunities that present themselves there. So before I transition over to Marina, I want to just make sure that you all are registered for the event, and open it up to any questions that you might have about what the day might look like or what we're trying to accomplish at the day. Is there any questions I can field at this point? Although I'll still be available as Marina goes through her slides. Hi, Denny. I see you. And Jack's next.
Thank you for that update on the day of action. One of the things I really appreciated from one of the previous days of actions was the chance to be with other EACAD members. I think it was in the morning. And so I'm wondering if you all are envisioning some separate alone committee time before with the big group.
Yeah, that I know that was something that was done at the 2022 event. It's definitely something to explore, and we do have the space if we want to convene the committees a little bit earlier for some networking. I do know that we want to be able to introduce, very similar to the 2022 event, the committees to the group. So there will be kind of that, I don't know what the term is, maybe March or entry, where we can elevate and everybody can know who the committee members are. So I appreciate you expressing interest in having some networking time in the beginning, because we do have the space and we can work with our logistical partner to have some designated areas, if that's of interest to all of you, to do that informal networking connections. Because yeah, the virtual stuff only works so far. That in-person opportunities is wonderful. Sorry about my dog. Thanks, Denny. Carol and I are kind of the leads on planning this meeting with our logistical partners, and all this information is just helpful as we build out that full agenda. So helpful. Thank you. Hi, Jax.
I just wanted to echo a little bit about what Denny said. For me, that was the first time I got to meet many of the people in person who serve in this committee, and probably part of it had to do with being out of COVID isolation. It was just a nice thing to do. And if for anybody who hasn't been to this, you have to be probably without a heartbeat not to get energized by this event. So I strongly encourage you to attend. But I don't know if it's just in the schedule. I know that in the registration it asked about food allergies and things like that, because there is an opportunity to eat something in the beginning, and I think there's a lunch. Is there a possibility that we could actually have a room somewhere in the convention center for meeting for lunch? I know last time we did that before everything started, it took a long time for us to gather people early in the morning to do that. And we didn't get a very good large number of people from our committee. So maybe by the time lunch comes along, people have actually migrated from wherever part of California they've been in, and it might be a little easier to do that. So that's just a suggestion.
Appreciate that recommendation. I think there's definitely some values in having like a committee hub where people can come to, throughout the day. So let's explore what that might look like. Thank you, Jax, and appreciate your genuine enthusiasm for the event. We have on the website, and Yia put the link in the chat. There's a great video that shows some images and some graphics from last year's event. And even in 1.5 minutes, I feel the energy, the excitement that everyone can leave with from that day. So thank you, Jax. Other questions from the committee member on just some of the logistical aspects of the day and what to expect and really what we're trying to accomplish? It's really designed to help us hear directly from the MPA committees, not only us at CDA, but all our state partners, even looking to invite our national partners to this event so they can hear about happening in California, hear about the robust support and advocacy we have in here in California as it relates to serving older adults, people with disabilities, and caregivers. And so it's we look forward to partnering with all of you to be a part of the event, and then also have a formal place on the agenda to highlight EACAD's work to date, as well as priority and recommendations moving forward. So Marina, I'll turn it over to you, but please know I'm still on the call if we need to continue our discussion together.
Great. Thank you, Jackie, for all those details. And so I have maybe 2 slides to share. And so as we move to the day of action, I want us just to be mindful, of our committee purpose and, what message we want, an impression we want to leave And so I identified 3 focus areas. One is always at the heart of the work we do, which is the people we serve. So good stewardship around that. And then being very intentional. I think much of what you brought up today in terms of the LGBTQIA plus study, you know, about how we are involved in that, how we operationalize next steps. So some of the questions you were raising and bringing up are all good things as we move forward and set intention about our work. Also the ad lib, you know, is another mechanism for us to really hone in on. And we heard about some ideas and thoughts there as well. You know, how do we get folks that maybe typically don't participate in ad lib or committees, you know, to come on board and encourage that, but really thinking at that level. And then also, you know, one of the areas I want to be really intentional with moving forward is whatever priority that we raise, how do we, you know, measure it? How do we know that we are moving the needle or the dial, if you will? And if we're not, you know, taking a step back, reevaluating, rethinking, redoing, whatever that may look like. So just as we open this dialogue about what those priorities can be, let's try to keep these thoughts in mind and others if you have them, and we'll go from there. Next slide, please. So I put some questions for us to consider, but before I do, I wanted to just share a few of the priorities that were identified in that survey that I mentioned earlier. So there was a survey, I think there were approximately 3 questions. We sent it out in February of 2024. It was sent to 16 members, EACAD members. 5 members replied, and 3 questions were asked. And because we didn't, you know, get a higher response rate, I wanted to bring it back to this committee so that we can have some further discussion. But question number 1 asked this: please mark the topics that you see as the top 3 equity priorities for EACAD in 2024. Identifying these priorities will help EACAD develop 2025-26 MPA initiatives and recommendations to elevate and present at the fall 2024 MPA Day of Action. So when I went back to just take a peek at what those priorities included, the number 1 was MPA Equity Framework. Number 2, and this again ties to a lot of what we discussed today, was around communications and messaging. What communications, what messaging can we develop, or, you know, toolkit or whatever that looks like, to inform people of CDA, the services available, the resources, where to go to for help, if you're a caregiver, how to get paid, all these questions that are being asked of us from, you know, I mentioned tribal, but other underserved and underrepresented communities. And then 3rd was data from the LGBTQI plus study and like where we go with it. You know, so we have this study, we have the findings. So what are we going to take from that study and build on from that? And then there were a few ties about aging farm workers and gosh, I'm forgetting one now. Maybe Consuelo, you could put it in the chat. So I just wanted to give you that kind of high level perspective from the few responses that we did get. And then I want to bring you back to the screen here. How will you prioritize your recommendations? What are the expected outcomes and outputs? How do the recommendations advance equity in aging, disability, and caregiving? And how do the recommendations align with MPA goals and initiatives? So my first question is really about the priorities I named. For those who responded, that's what was raised. but I want to open the floor to see if other members who didn't respond are in alignment with that and what that looks like. You know, if we were to present on this and get questions on this, you know, being on the same page. So I'll stop talking and open the floor up to you all. I just read in the chat, the other priority area was tribal engagement.
Sorry, Marina, can you just list the priorities again?
Can I have someone list them in the chat as well? So number 1 was MPA equity framework. Second was communications and messaging. The third one was data from LGBTQIA+ study. And then I believe there was a few that voted also in third place for aging farm workers and tribal engagement. I'm looking at the chat right now as we speak. Thank you, Ephraim. Okay, from Jax, I'm good with all of it. Yes, tribal engagement is very important now that staff is devoted to the initiative. Aging farm workers and tribal engagement from Ephraim. And then Danny, I'm good with these priorities too. Okay. All right. So let me dig a little deeper. And let me ask, I'm gonna go to the tribal engagement. We have Consuelo on, and maybe Consuelo, you could just share a little bit about what's in the queue right now that we've been elevating to leadership, and then get some reaction from the members.
I am unmuting Consuelo's line.
Thank you.
I think you can speak, Consuelo.
Hey, yes, can you hear me?
We can, thank you.
Okay. Yeah, so some upcoming things that we have on the horizon is we have sent out formal introduction letters to all of the tribal Title VI grant recipients. So introduction letters from Susan on behalf of the CDA, just introducing ourselves and highlighting the AAAs within their area and also inviting them to the Day of Action in October. So those went out, I believe, a couple weeks ago. And also we have developed a brief survey that will be distributed to the AAA network to kind of build our understanding of what their current and existing tribal engagement looks like. So that is on the horizon, and that will be sent to our AAAs this month. So just want to build our understanding and how the CDA can provide support to the AAAs as well. So that is on the horizon. Also a number of tribal presentations that I will provide to some committee meetings and tribal organizations as well. Thank you.
Thank you, Consuelo. Oh, you see your hand, Jackie?
Yeah, just to provide some like additional context for the actual date of the meeting and collecting such recommendations from each MPA stakeholder committee. We're looking to actually have your formal recommendations to the state for probably about mid-August. So we're looking at about 4 to 5 weeks from now. And so with these topic areas, I would be curious about some conversations about what would be a formal recommendation around tribal engagement moving forward? What would be a recommendation around aging farm workers, if that was the area that you all were going? Because we're looking for each stakeholder committee to be able to not only share in a written format their 3 recommendations for the day of action, also helping us think through how your recommendation advances equity in aging and disability, how the recommendations align with the current master plan for aging goal areas, but then also at the actual day of action, have that opportunity to present it broader than just, you know, what is given to the state, but be able to tell that story at the day of action as well. So others hear your priority recommendations as well.
Thank you for framing that, Jackie. And so I appreciate all the commentary in the chat. And so I just wanted to make sure this for me was just a touch point with you all to make sure that we are on point with or in agreement to a certain degree with these priority areas. I'm sure we'll have time through either reaching out or scheduling another meeting as we formalize them further. If there are specific areas that you would like represented. So for example, Alvira put in the chat about state-based data, which can further provide info regarding older farm workers. You know, so if there's a lean towards gathering resources, information, or in the communications and messaging area, where yes, it would be good just to have a fact sheet and it would, you know, to distribute in multiple languages, whatever that looks like. I welcome those ideas. I know we, you know, some of our time together is constrained, but again, I'm available, me and my team, to further explore. And when we get that input, we are committed to outlining that and sharing that with the committee to receive your feedback before, you know, the day of action. And I'm hoping that once we have that written feedback as well, we could come together and just walk through it so that we have a shared understanding of what we'll be presenting, if it's a presentation or if we're participating on a panel, whatever that looks like, that it will be representative of the EACAD group. Does that make sense? Do you have other recommendations on moving forward? Go ahead, Jackie.
Yeah, I can wait a moment to see if committee members have some initial thoughts and reactions to your question. So I see Denny, so I'll wait until committee members have weighed in.
Okay, I see Denny and then I see Danny.
I'm just wondering what so I'm also in agreement with the 4 priorities that the group is in alignment on.
Okay.
I'm wondering what the process is for answering the questions that Jackie has posed. Are we doing that in our remaining time? Will you set up another meeting? I actually think it's probably, I guess my thinking would be that it's helpful to hash it out in a group, but probably easier for someone to come up with like a quick draft so that people can respond to it as opposed to trying to write something together as a group. So that would be my recommendation.
I wrote down your recommendation and I will raise that to, you know, I want to make sure that we're, not that we have to be consistent with the other committees, but I think I agree that having something to work from will works better in certain circumstances. So I wrote that down. Thank you, Danny. Danny?
Denny and Danny, we always seem to team up. I was just going to piggyback on what Denny was asking around process, and if it might be helpful to submit ideas and suggestions via email so that a draft can be drafted. And then I also agree, if it's feasible, I know it's so difficult juggling everyone's schedules, but to actually discuss through the ideas prior to the day of action.
Thank you.
One thing I also wanted to add, just based on conversations that I've heard from EACAD and the spirit of EACAD, is also a recommendation could be about continuing to elevate and integrate the community's voice. And so a recommendation could be structured around the Lived Experience Advisory Board and how that can again be integrated throughout the MPA. So there's an opportunity with an existing or planned project and to kind of align all the pieces there, because I think that there's a lot of value and return on investment on that particular advisory board and how it can impact the MPA moving forward as well. So just food for thought for the committee to think through how perhaps the Lived Experience Advisory Board can be part of your recommendations as well. So just wanted to put that out there.
Good point. Thank you. All right. Seeing no other hands, I think we are at our time for public comment. So I'm going to turn that over to you, Carol.
There we go. I'm not on mute. Thank you very much for joining us in this meeting thus far. It's been a great conversation. Heard so much interesting information. So it'll take a moment to digest. This is our public comment period, where we hear from our public attendees. If you would like to provide a comment to the committee, and you are appearing by phone, you would press *9, which would indicate your desire to speak, and we'll unmute your line. Or if you're attending by webinar, feel free to click the Zoom webinar raised hand function, and we will unmute your line. And we do have an individual appearing by phone. You are unmuted. So please go ahead. 916-281-8639 is your number. Can you unmute your line?
Thank you.
Great. Go ahead, please.
Hello, my name is Rita Grady, and I am interested in all of your activities as I would like to be considered a consumer stakeholder. I have impaired mobility and I need personal care assistance. And I have been using private pay and assistance from a full service agency. So I understand what our people in a like situation is happening to them. I'm interested in providing advocacy for seniors so that all receive consistent care and support provided by engaged professionals in a manner that is satisfactory to the consumer and the home assistant. Right now, what I see is that we have no standard of practice for in-home personal care attendants. In fact, every county has a different title for this non-medical worker. I feel that we need to have an identified skill set with the job title and associated job training and some sort of a consistent salary and expectations of what they are going to be able to do, or renewable certificates that are reporting to a responsible public entity. Isn't that wonderful? So at this point, I want to say this is the second meeting that I have listened to, and I want to compliment and praise all of you for the scope of what you're doing and the professionalism that you display. I myself am a retired nurse educator. So anyhow, I would love to join the group if there is a spot somewhere for folks like myself, because I think that I'm in a position to communicate to a lot of other seniors. Thank you.
Thank you, Rita. I know that you have emailed Engage before. May I ask you to do that one more time just to make sure that we have your email address and contact information, so we can attach it to this comment and forward to the committee leads. Thank you. We appreciate your comment and your participation in listening in today.
Thank you. My pleasure.
Thank
Privilege, in fact.
Thank you.
Okay, goodbye.
Any other comments from our webinar attendees or by phone? Happy to have them. And of course, if at any time you would like to email a comment, we're happy to receive them. Please email our Engage email box, engage@aging.ca.gov. And that email box is monitored. And so please feel free to email at any time and we will get it to the right people. If it's with regard to this meeting, we will make sure that Marina and crew receive it and she can share it out with her committee members if appropriate. So it does not appear that we have any more comments, Marina.
All right, well, take it away. Thank you, Carol, and thank you, Rita, for joining our committee meeting for the second time. And so I just want to highlight a few items that I heard and, you know, a few items for follow-up. There's a few meeting reminders and links to get more information up on the screen. So just kind of running through my notes as I'm you know, taking them on the side. So so Susan acknowledged that there will be a tribal resource guide forthcoming. As soon as we have that, we'll be happy to share that. I believe Consuela and I will be supporting the development of that. I want to give a huge shout out to Ross, Vince, and Jax for all your work on the LGBTQIA older adult study. There were a number of questions related to understanding administrative data versus other data, you know, comparisons between rural populations and any contrast and differences, and then data compared to other older adults. And so there was also a request to possibly have Jupiter Barraza and Kathleen Sullivan to come to present to our committee to hear a little bit more. Vince also requested if it's possible to have use talking points that Ross used for the day of action related to the study. And so we'll follow up on that. Moving right along in terms of the ad lib, Jax made a recommendation as far as changing verbiage on the framework for part 2, and also made a suggestion about if we really want to bring on or recruit folks that we might consider looking at the AAA's community advisory groups. Denny brought forward, again, this is related to the ad lib, about having Maya at the day of action, and then concerns about continuing to, you know, work in a vacuum or a silo, this committee, and how we kind of integrate out and further expand, you know, our reach. And then I also have that, you know, just being mindful and cognizant of, you know, adults who aren't receiving services and trying to recruit individuals to participate to give us their insight regarding that. We also acknowledge that sometimes there's not enough seats at the table, but being intentional about that. I also pointed out that anyone who is interested in working more closely with Maya and team in the further development of the recruitment effort, the charter for the ad lib, to please reach out to me. I'm also hoping to, you know, reach out to Maya to see if we can arrange a meeting for those of you who are interested to be on a call and get to know her, and we can, you know, dive deeper into her project proposal on the ad lib. There was a request to carve out some time for EACAD members, networking time for EACAD members to meet in person on the day of action. either in the morning or for lunch. That just gives us an opportunity to connect and get to know each other a little bit more. And then let's see. Most everyone agreed with the priorities for the day of action. There were questions around process and how to provide recommendations, and also if something can be framed for the recommendations before all the committee members weigh in, and that this could be done via email, and if possible, to arrange a discussion. And then just acknowledging Rita Brady, providing her contact information and wanting to participate on this committee. And so we will be following up with her. If I missed anything, please email me or send me something in chat. And thank you all again. I appreciate your time, and I look forward to our continued work together. More to come.
This concludes our EACAD meeting. Thank you for joining us.
Be well, everyone.
Thanks, everyone.
Take care.